What is coronavirus? Coronavirus are a family of viruses that cause illness ranging from the common cold to more severe diseases such as Severe Acute Respiratory Syndrome (SARS) and the Middle East Respiratory Syndrome (MERS). These viruses were originally transmitted from animals to people. Name coronavirus comes from a Latin word corona, which means crown or halo. Under an electron microscope, the virus looks like it is surrounded by a solar corona. The novel coronavirus, identified by Chinese authorities on January 7 and since named SARS-CoV-2, is a new strain that had not been previously identified in humans. Little is known about it, although human-to-human transmission is confirmed. What are the symptoms? Symptoms include fever, cough, shortness of breath, and breathing difficulties. In more severe cases, it can lead to pneumonia, multiple organ failure, and even death. Current estimates of incubation period range from 1 to 14 days. Most infected people show symptoms within 5 to 6 days. However, infected patients can also be asymptomatic, meaning they do not display any symptoms despite having the virus in their systems. How dangerous is it? With more than 15,000 recorded deaths, the number of fatalities from this new coronavirus has surpassed the toll of 2002-2003 SARS outbreak, which also originated in China. SARS killed about 9% of those it infected, nearly 800 people worldwide and more than 300 in China alone. MERS, which did not spread as widely, was more deadly, killing one-third of those infected. While the new coronavirus is more widespread than SARS in terms of case numbers, the mortality rate remains considerably lower at approximately 3.4% according to the WHO. Where have cases been reported? Since March 16, more cases were registered outside mainland China than inside, marking a new milestone in the spread of the global pandemic. Deaths have been reported in several countries, with Bahrain recording its first fatality in the Gulf on Monday. The virus has spread from China all around the world, prompting the WHO to designate the COVID-19 outbreak as a pandemic. Human to human transmissions became evident after cases were recorded with no apparent link to China. Who is at high risk? Old age and debilitating persons, people working in crowded places, and healthcare providers. What can be done to stop coronavirus from spreading? Stop close contacts. Hand wash and hand hygiene. Maintain at least 1 meter distance from stranger. Confirm the traveling history of contacted person. Cover mouth by hand or handkerchief while coughing. Use of mask while going outside.